The World Health Organization wants to eliminate viral hepatitis as a public health threat by 2030. It's a lofty goal, but groups such as the Canadian Association for the Study of Liver Disease believe it is achievable. Calgary doctor Mark Swain says part of the problem is inequities in access to testing.
Many members of the priority population, so the Indigenous communities, people who use drugs or have used drugs in the past, and a number of the other groups that Jennifer mentioned, they don't or they can't access care. And so because they can't and they don't, they are not tested. And because they're not tested, they don't start the pathway towards care.
It is estimated 3/4 of those living with hepatitis C were born between 1945 and 1975, and as much as 50% of this number remains undiagnosed. According to a 2019 Canadian Network on Hepatitis C study, rates are 5 times higher among Indigenous peoples than the general population. Swain says governments need to move more quickly on available rapid testing technology.
We're all very familiar with COVID, and we're all very familiar with going to get testing. And we used to have to go get the swabs, and then do the PCR test, and we did wait 48 hours. Now everyone has the antigen test. You just do you just do the swab at home, and then you test it, and you know very quickly if you have COVID. And so there's tests like that available for hepatitis C, but they're not approved in Canada.
Mercedes Russell started using drugs at 17 and eventually contracted hepatitis C. She's now 4 years sober and Hep C free thanks to advanced viral drug therapy. Russell says she understands why people don't want to get tested.
And then the people that are still using, they feel like they have to quit drugs completely in order to get rid of the disease. So that's another barrier that stops some of the drug people that I used with, or was one of the issues that I had too. Previously, I didn't want to quit when I was in full active addiction. I didn't want to quit.
She says she hopes by telling her story, she will encourage more people to overcome the stigma, get tested, and save lives.
You don't want to go get tested because you know the person that's going to test you, or the stigma behind that. That's why I think I stand up now. In the beginning, I was hesitant to, but I think the more and more that I've accepted that I had Hep C, I think I can be an advocate, especially for my people, because a lot of my friends are still using. A lot of them are dead.
Fraser Needham, APTN National News, Ottawa.